Hello everyone, this is Stephanie Loddick, and I am recording a PowerPoint regarding measuring nurse practitioners' performance, which is Chapter 15 of Nurse Practitioners' Business Practice and Legal Guide. This presentation is for Nurse 916, Nurse Practitioners' Roles in Primary Care. Measuring or assessing the performance of the nurse practitioner. Nurse practitioners are measured or assessed on performance to determine whether standards of care were met for each patient. Measuring performance and standards of care are interrelated. Without standards of care, there would be no point in assessing how the nurse practitioner is performing. General questions that should be asked to assess the quality of care the nurse practitioner provides include: was the right thing done for each patient? Is the care provided effective? What was the patient's outcome? Did they improve? Did their condition go away? Was the care given at an appropriate time? And was there timely follow-up for chronic conditions or high-risk scenarios? What is evaluated during the nurse practitioner's performance review? Productivity, utilization, patient satisfaction, and quality of clinical decision-making are all considered when we are assessing how nurse practitioners perform care. Productivity. What is productivity? Productivity basically equals payment. Setting and method of payment determine productivity of the nurse practitioner. Typically, a highly productive nurse practitioner generates revenue or RVUs for the facility or the physician, provider, hospital that they are employed by. Payment is often determined by reimbursement through health insurance, but payment may also be determined by patients paying independently and out of pocket for the services that the provider performs for them. There are different types of reimbursement through health insurance companies. Fee-for-service is one structure of payment, and capitation is another. Fee-for-services means that the provider receives fees or payments for each separate service that they provide for patients. It's typically a structure that allows providers to receive more revenue or payment for the services they provide. Capitation is a performance-based system. This system provides financial incentives to providers who perform appropriate care and treatment to patients. This care is aimed at improving the health and wellness of the population, and providers receive payment or incentive for health promotion activities. Utilization. Utilization is another way that nurse practitioners are evaluated by health insurance companies. Utilization means that nurse practitioners are evaluated based on the care or the referrals that they put in for patients. Insurance companies want to decrease utilization of high-cost centers. This means that insurance companies do not want nurse practitioners or providers in general to admit patients to the hospital. They don't want nurse practitioners to send patients to emergency rooms. They want the least amount of specialties being referred for patients. This helps insurance companies to save money if nurse practitioners are not utilizing these high-cost centers. Admissions and referrals to specialty providers need to be kept to a minimum in order to improve performance ratings from insurance companies for nurse practitioners. Patient satisfaction is an important consideration on determining how the nurse practitioner is performing. Patient satisfaction and outcomes should be highly important goals that nurse practitioners have when they are determining how they are performing care for patients. Quality of care, expertise and knowledge of the nurse practitioner, bedside manner, validation of the patient's concerns, thoughts, and condition, as well as compassion towards the patient and their situation, all go into how a patient is satisfied with the care that they received. Patient satisfaction is determined by a multitude of different situations and scenarios that have a hand in what the patient thinks and feels the nurse practitioner did for them. Quality of clinical decision making is another aspect in determining how the nurse practitioner is performing. Nurse practitioners should be assessed on the appropriateness of the diagnosis that they are giving a patient. Was it the right diagnosis? Was the diagnosis received in a timely manner by the patient? Was treatment appropriate for the diagnosis that the patient had? Was it timely? Is there a close interval follow-up for this patient? Interval follow-up needs to be close for high-risk patients and chronic conditions. Were there appropriate referrals to specialty providers as necessary? These are all part of quality clinical decision making that the nurse practitioner is assessed from. So who is the judge of the nurse practitioner's performance? There are many judges for the nurse practitioner: employers, patients, health plan auditors or insurance companies, the government, peers such as other nurse practitioners and physicians, as well as researchers, all assess the care and the performance of the nurse practitioner. Employers are continuously evaluating the nurse practitioner's performance, and performance from the nurse practitioner may be based on a multitude of conditions and occurrences. The nurse practitioner needs to determine the values of the employer to decide what is considered high performance in the employer's eyes. High performance by the nurse practitioner may equal high billing. The nurse practitioner is capable of bringing in a large amount of revenue for the facility they work for if they are capable of billing for procedures. Patient satisfaction is another way that nurse practitioners should be measured by their employer. Highly satisfied patients generate revenue for the company that the nurse practitioner works for. Communication skills may also determine high performance for the nurse practitioner. Independent or team functioning with a physician may be another way that the nurse practitioner is evaluated. In states where our nurse practitioners independently function, a dependent nurse practitioner would be low performing. However, in states such as Kansas, where we require a physician to be our practice guide, the nurse practitioner that has a successful relationship with a physician and is a team unit would be highly performing in that scenario. Patients continuously judge nurse practitioners. They make an assessment of their nurse practitioner with every visit they attend. Patient rating of the nurse practitioner is typically determined through survey results. Patient surveys are conducted by health plans and practice or facilities that the nurse practitioners work for. Survey results can be reviewed by potential clients and other providers through various websites. There are multiple factors associated with patient rating of nurse practitioners. Individual ideas and beliefs affect how they perceive care received. So, We also need to consider that patient's social situation. Was the nurse practitioner kind to them? Did the nurse practitioner assess their concerns? Was their admission to a room timely? All of these ideas discussed have an effect on how the patient judges the nurse practitioner's performance. Health plan auditors or insurance companies and the government also assess the nurse practitioner's performance. Health plans or insurance companies often base performance on the cost of services rendered. So expensive resources such as hospital admissions and ER visits lead to lower performance ratings for the nurse practitioner. Medicare and Medicaid are government agencies that assess the nurse practitioner's performance, and high performance is based on incentive measurements. Merit-based incentive payment systems are measures that the nurse practitioner has to meet or check mark within desired percentiles to have high performance ratings. Performance in these two categories overlap. Peer reviews. Peers are an important consideration for the nurse practitioner. Peers may include other nurse practitioners, physician assistants, or physicians. Many organizations, such as the Joint Commission and facilities that the nurse practitioner may work for, require regular peer reviews to be conducted. Peer reviews may be done through shadowing the nurse practitioner. They also may be done through chart audits. Typically, peers of the nurse practitioner assess the nurse practitioner on their skills, knowledge, communication, and interactions. Nurse practitioners are judged and assessed based on whether they met standards of care and whether they provided the same care that another competent physician or nurse practitioner would have provided to a certain patient. Researchers are very interested on nurse practitioners' performance. They're interested to see how nurse practitioners compare to physicians or physician assistants. Studies are typically completed to review the appropriateness of treatment provided by the nurse practitioner. Was there close interval follow-up for the patient of a nurse practitioner? Patient's reports on care received. So was the patient satisfied? Did the patient feel safe and comfortable being under the care of a nurse practitioner? Cost of care and cost effectiveness are another major consideration by researchers, and the levels of care that a nurse practitioner is capable of giving to a patient is assessed by researchers. The National Committee for Quality Assurance measures the clinical performance of nurse practitioners. One way that they do this is through the HEDIS measurements. HEDIS means Health Plan Employer Data and Information Set. It is a set of clinical performance measured aimed at primary care providers. This set of information on clinical performance indicates what employers, consumers, and health plan executives think are important. The scenarios that are reviewed are based from 800 suggestions. Such measures that HEDIS dictates are important are that at least 80% of female patients that this clinic or the nurse practitioner sees, aged 50 to 74, have had at least one mammogram in the past 2 years. Another consideration or measure that is reviewed is that at least 80% of women aged 21 to 64 have had a pap smear in 3 years, or that 97% of pregnant women have received prenatal care in the first trimester. These are all goals that HEDIS has that a nurse practitioner and other providers must meet if they are practicing in primary care. There are a multitude of organizations that measure the performance of the nurse practitioner: the Centers for Medicare and Medicaid Services, the Joint Commission, the Agencies for Healthcare Research and Quality, certain managed care plans, and varying state health departments all assess nurse practitioners' performance from time to time. Nurse practitioners should also be performing self-evaluation to determine how they are performing care. It is important to utilize self-monitoring to ensure that we are providing high-quality patient care. We need to explore individual traits and practices because individual traits and practices have an effect on how the nurse practitioner manages patients. Questions should be tailored to personal nurse practitioner practices and the patients that he or she sees. There is a multitude of existing research on nurse practitioners' performance and how it compares to other providers of care. One specific area that is reviewed in many studies is the cost effectiveness of nurse practitioners compared to other providers. Associated costs for the nurse practitioner when compared to other providers are reviewed. There are many studies that have found that costs are lower for patients of nurse practitioners, and they typically have better outcomes for these patients. Effectiveness, safety, and acceptability of nurse practitioners when compared to providers is a hot topic. There are very few differences found between nurse practitioners and physicians. Nurse practitioners are providing safe and effective care for their patients. Oftentimes, the care was found to be superior, especially in areas of patient satisfaction. And the length of stay in hospital admissions was shorter for many nurse practitioners. I have included my references to the textbook as well as the studies listed on the previous research slide. Thank you all for your time. I hope you enjoyed Chapter 15.